Greetings, theists and non-theists. I'm the Atheist Paladin. Okay, what do I like about the Obama bill, and what do I think is bad in the Obama bill? Well, when I was reading the bill, I, of course, looked at what all they're saying. Oh, you know, there are death panels here, and ration care here, and really all that right-wing shit. Of course, they didn't understand the bill. I didn't see any rationing, maybe some encouragement to try to be efficient at what they do. And the death panels, of course, they didn't exist in there. Which actually brings me to the first thing I actually like about the bill is what they're saying is death panels. The doctor giving the patient what they should know about power of attorney, medical power of attorney, living wills, and all that stuff. I think that is actually good. I think people actually need to know about that stuff. And I actually have a story that relates to this because I actually had an uncle that died recently of basically respiratory complications, and he wanted to give one of his step-granddaughters something. He really cared about her. But if she didn't want it, then he was like, okay, then never mind then, sort of thing. And I think if the doctor really explained about wills to him, he might actually had a will, because when he died, he had no official paper or will whatsoever. So as a result, the estate is basically still in limbo. He died sometime in November. Of last year. It's August now. So as you can see, there's lots of headaches in dealing with dividing up of the estate. If he just simply say this goes to this person, this goes to that person, we would have a lot less headaches right now. Especially since we have, of course, one of those family members that doesn't want to talk to anybody, and he's out in the middle of nowhere. We don't know how to reach him, we don't know where he is, basically. And so we have to give him his share of estate. And really, on my uncle, he would have cared if he would have gotten anything. But because he is the son of one of his brothers, and that brother's dead, of course, he gets what would have been his brother's share, sort of thing, or his father's share. And so right now that's a big headache to me. So that I would like to actually see something like that in any healthcare reform. I'm glad to have that, death panel in there. Another thing that I liked about the bill is the encouragement of school-based clinics. Good way to learn, good way to get, cheap clinic care. It's, of course, you'll get what you pay for, or you get used to that sort of, bumbling care that somebody's actually learning the system. Of course, they'll be supervised by already qualified doctors, but again, somebody gets to learn to become a doctor, and you get your care. I think that is, again, that's something that's great. Now, the problems that I have with the bill, and this is because I actually researched what is killing our health care insurance now. And one of the proposed is actually the guaranteed guaranteed insurance issue, is that if you're sick, then you're supposed to get it guaranteed. And there's actually been states that actually passed similar laws for this, and it all killed their health care. Think about it. If you're guaranteed to get insurance when you're sick, then what guarantee do you? Then what reason do you have to get it when you're healthy? So as a result, that lowers, the amount of people who actually get insurance, because why pay for insurance now? I don't need it now. I'll just wait till I'm sick, and then you'll get it then. And so that creates more uninsured. So instead of having people that are sick insured will now have a bunch of unhealthy people, healthy people, not get insurance. And this actually does have an effect. So as an effect of the insurance companies forced to take on unhealthy people, and that raises the costs, of course. And then so, well, if I'm guaranteed, why stay insured? And the costs are going up. I'll just drop the insurance. So as a result, as what happened in New York in, is it 1994 or 1993? You'll be seeing the number now. But sometime that year, that's what happened, and the number of uninsured increased by 12%. And we're going to do this on a national level? No, this is going to kill insurance. So that is one bad in the system. Another bad is, the second bad is the, basically the regulation of what you can charge. So now you're dictating of what can be charged, and it says, in one portion I think, it says the lowest premium plan you can get cannot be in a ratio more than 2-to-1 to the premium plan. So the premium plan cannot be no more than twice as expensive as the lowest grade plan. So what do you think is going to happen in this situation? Okay, before I was interrupted, it sets the problem with setting the price, especially in ratios like this. The more expensive plan is not going to come down. It's always the lower plan that's going to go up. And so, as a result of doing this, they're just going to make the lower plans more expensive for the people. And as a result, of course, less people get not as insured as well. So less people can't afford the insurance. Third problem is that there is a mandate in the bill that pretty much makes it the responsibility of the employer to get the health insurance for the person. And if they can't do it properly, then of course they're automatically enrolled in the public option. At least according to the bill. The issue with that is that kills small business. Some small businesses maybe not be able to afford health insurance, and so they can't provide that benefit to their employees and give that benefit to everyone. And so, so the problem that creates more basically financial responsibility and strain on small businesses, and is going to make them more likely to fail. That is something like that may be good for people, but it's bad for growing businesses. Another issue that I have with it is that it puts a lot of regulation or a lot of stipulations that you'll get enrolled in the plan, the public option if this or if that, and even the government can deny you Medicare or Medicaid or anything else you might qualify for, or any other insurance, and say, no, you're going to the public option. So this Obama saying, oh, you can keep the health insurance you got. I have to say, yeah, right. After all the other regulations kill the health insurance company, you'll have no one else to go to. So the premise of this public option somehow providing an actual competition is nothing but ridiculous. Why is one more option going to solve all the problems when the real problem is the lack of actual competition? And you're just going to put one more in there and then have the ability to basically undercut all those other companies with your tax dollars. So if you get another plan, you're paying your tax dollars to undercut the insurance that you got, so it'll go out of business, so you'll have no other choice to go into public option. I just really don't believe, from what I'm looking at, of actually keeping the insurance. I just don't believe it. I'm seeing a system that is pretty much what they're suggesting, prone to collapse and have no other choices.